And is there such a thing as male menopause? We're going to take a closer look at the symptoms and treatments. Some doctors say it's definitely an issue for people over 50. Menopause isn't just for women anymore. Doctors say men in their 50s and above are susceptible to what's generally known by doctors as andropause or male menopause. Dr. Larry Emdur with Alvarado Hospital joins us now to explain what is really a fairly new phenomenon, right?
That's actually true, and I think one of the reasons is that when women go through menopause, there's a precipitous drop in their hormone levels. But for men, specifically the estrogen level, the testosterone level, it drops very slowly, so the men often do not recognize the symptoms.
So why men 50 and above? Why are they, in the category that's most at risk here?
After age 30, all our hormones are dropping, and for men, testosterone is really one of the most important hormones. It's responsible for, obviously, our aggressiveness, our muscle mass, our quick thinking, and when the levels drop, what happens is we tend to get depressed, we're not as sharp, we have problems with our memory, but it also can affect our health. You're at increased risk for diabetes, heart disease, Alzheimer's disease as your levels drop.
So this isn't any laughing matter. It's could be possibly deadly.
Oh, absolutely. There was a local study done at UCSD where they looked at men aged 50 to 90, and they followed them from 1984 to 2004, called the Rancho Bernardo study, and they found that the men with the lowest levels had a 40% increased mortality rate over the 20 years of the study.
What's a normal testosterone level in a man? In their 50s.
Yeah, well, a young man obviously is going to have higher levels greater than 600. In this study, men whose levels were less than 250 were at increased risk. So I believe every man over 50 should know what their testosterone level is, and they can ask their physician to order it. It's a very simple blood test.
And the study that you're talking about, this is a very recent study from 84 to 2004, came out in 2007. Where was it published?
It's in the American Journal of Clinical Research for Endocrinology.
Gotcha. And a landmark study, and it's kind of controversial still, right? Andropause?
Well, it's recognized as an entity. The controversy is at what level do you treat at. The American Endocrine Society, they generally don't want to treat unless your testosterone levels are less than 200 with symptoms. This particular study suggests maybe a cutoff of 250 patients should be treated.
And it's a noticeable behavioral change. The person that has andropause, the man that has it, may not notice it, but family members and friends definitely notice a change, correct?
The change that you'll see is increased truncal fat around your midsection. You won't be thinking as quickly or as fast as before. You're more prone to hip fractures, osteoporosis. Basically, the men lose their mojo, their assertiveness, and that's all testosterone related.
The mojo. All right. Well, what are the treatment options? What treatment options available right now? So, you don't have it. Again, it can be dangerous.
The main treatment options are once a week injections that you can give yourself. Secondly, there's transdermal creams that you can apply.
And injections of testosterone.
There's injections of testosterone you give yourself on a weekly basis is one option. There's transdermal gels and patches that you can apply to your skin. And the third option is there's pellets, testosterone pellets that can be injected into your buttocks. It sounds painful, but it's done surgically, and the levels are good for about 3 months.
What should a man do, or a family member, or a friend of someone who thinks that they may have andropause?
They should see their doctor. They should get a testosterone level, and if their levels are low and they're having symptoms, I believe they should seek treatment. And
oftentimes, again, a man may not even know that this is going on.
It happens so insidiously that you don't recognize it as a problem. But probably, we know at least 30% of men over 50 are in andropause, and maybe as high as 50% over 60 may actually be in andropause.
So a lot of people joke about it, male menopause, andropause, but it's a very serious subject and something that men over 50 should take very seriously.
If your levels are low, you're at increased risk for diabetes, heart disease, Alzheimer's disease, and death. That sounds pretty serious to me.
All right, Dr. Larry Emdur with Alvarado Hospital, thanks so much for being with us this morning.
Yeah, thank you.
All right. And of course, for more information, go to our website, san diego6.com.